Hey everybody, welcome to my channel, The Ready Nurse Nay. Today's video we're going to be talking about the fact that my patient died. So, and my thoughts and feelings concerning that. So obviously, to protect HIPAA and follow HIPAA, I will not be telling you any specifics about this patient. I won't be telling you their gender or what they came to the hospital for or anything like that. I'm just going to use very generic terms. I'm going to use the pronoun they, and I won't use any specific diagnosis or anything like that. Just literally talking to you about thoughts and feelings of my patient passing away and how this happened. So a little bit about me, introducing myself. My name is Nay. I'm the Ready Nurse Nay. I'm a nursing student. I'm in my clinical semester. I'm also at the park, so you might hear a little noise here and there, but it's so pretty, so I came to do my videos here today. I'm a wife, a mom, a employee. I'm a part of, really big into certain organizations and personal obligations I have going on, so I'm very busy. And as a nursing student, I'm in my clinical semester, which means I'm actually going to the hospital and taking care of patients. So on this particular day that I had clinical, I go to the hospital, right? And I'm assigned the patients that I have to care for that day. This certain patients that I had specifically was very advanced in age. But other than that, the person was generally like healthy for the most part. But because they were advanced in age, they had all of these different like health complications. The doctors were talking to that individual about end of life care, right? So because I am taking care of that patient for the day, I am a part of those conversations. So I'm in there, and the doctor comes in there talking to the patient, and basically they're like, the conversation goes something like this. I'm paraphrasing, okay? But the conversation goes something like this. Hello, so-and-so, the patient. You have all of these different health disorders going on in your body. You need this surgery, this procedure, and this done in order for you to keep living a healthy life. Right now, you're not getting any better. You're not getting any worse. So with that being said, if something were to happen, would you want us to do everything we can to keep you alive, which would be a full cold, or would you want to pass away peacefully, which would mean we would switch you to a DNR, which means do not resuscitate. And so the patient kind of sits there and thinks about it and replies to the doctor, I've lived a long life. If I'm gonna go, I'd rather go peacefully. And he says it in a peaceful way, but it's also kind of like a bittersweet, where you could tell the patient was a little, there was a little sadness, but also like a peace with it too. So I'm in the room, and of course it's kind of a sad moment, so I'm trying not to cry or whatever. So I kind of, clench my toes in my shoes so that I can kind of focus on that, so I can stay emotionally stable to be there for my patient, right? So the doctor walks out, and I'm there with the patient, taking care of the patient, making sure they're clean, giving that patient their medications, and different things like that. So when I'm finished all of my work and I'm basically clocked out for the day, I get a phone call, text message, basically letting me know, hey, that patient passed away. And then I immediately kind of go into like deep thought, thinking about just my interactions with the patient and just how I felt. And it kind of made me think, which I already know, it's very important to treat people how you want to be treated. And as a healthcare professional, no matter what you are in the hospital, when you're taking care of patients, you're taking care of somebody, that's somebody's mother or father or sister or brother or spouse or somebody's loved one. So you want to take care of them the way that you would want somebody to take care of you or your loved ones if they were in that situation. It made me think of that, and just how you need to treat people how you want to be treated. And then just thinking about, like, that's crazy that we were the last people, as those healthcare professionals, total strangers, but providing excellent care to the patient. We were the last ones to see that patient alive. It's crazy to think that, maybe I was the last person to hold that patient's hand. I was the last person to ask that patient how they were doing that day, or the healthcare staff. We were the last individuals to bathe that patient, make sure that they were clean. The last individuals to interact with that patient and compliment them on their hair, or compliment them, on, their rings or something for that day, or as healthcare professionals, the last people to just take care of that patient. Listen to them talk about their like stories, and reminisce on when they were younger, or reminisce on good times that they had raising their children. Just talking to them and telling their stories, how you are can be that last person. We were the last person to see that patient. The family members weren't able to make it to the hospital in time because they didn't know that that patient was going to die that day. The family members weren't there, the spouse wasn't there, the kids or the grandkids weren't there. We were the last people as healthcare professionals to see that patient alive. And so it just made me think the importance of, treating people how you want to be treated, and just how, life is so fragile. So, don't take stuff for granted. It happens a lot, y'all. People, don't take it for granted that you get a surgical procedure and you come out alive and everything is working properly, because let me tell you, it's not like that for everybody. Sometimes people go in there, get a surgery, and then come out and are worse off after the surgery than before because they had some type of complication, or they go to the hospital with something like a simple strain or sprain and end up dying from something else. So don't take your good health for granted. Don't take your loved ones for granted. Tell your loved ones, I love you. Tell your spouse and your kids and your family that you love them and you care about them, because life is fragile, and one minute you're here and the next you're not. So those are just some of my thoughts and feelings that, of course, I already know, and I'm going to treat people how I want to be treated and take care of them with the best care that I possibly can give. But it just kind of reiterated it for me, how that patient for the most part was healthy. We were not expecting that patient to die that day, but they did. And sometimes that happens. But as a healthcare professional, and for me, you can have peace knowing that, I provided the best quality education and treatment for that patient that I could. I made sure that that patient was clean. I made sure that I gave that patient their medication. I made sure that I helped them with eating if they needed help with that. I did the best that I could in my role, and the doctors did the best they could in their role, so that you are giving your patient the best possible outcome for them to be healthy, to be happy, to be safe and comfortable, because we can't control whether a patient lives or dies. So, and then if that happens, you can still be peace that knowing that, I did the best that I could in that job, and whatever happens after that happens. Like, we can't control that. So that is, I guess, my feelings for it when my patient passed away. Just making sure you treat those patients the way that you want to be treated, being thankful for your health, and when you have good outcomes, if you have to have surgical procedures or something like that, being thankful for your loved ones, and showing that thankfulness while you are here, is kind of what was reiterated, what I thought of in that scenario. So hopefully this was kind of encouraging or eye-opening or a blessing or whatever for you. And like, comment, share, and subscribe. See you in the next video. Bye.